Good afternoon and welcome to Project Scovid. I am your host, Tristan Lee, and I am coming to you today, Friday, November, I think it's like the 18th. I'm not sure. There's a lot going on. It's very cold out. I hope everybody's having a good Friday. But we are going to be talking to the fabulous Zemoria Brandon today, who I am very excited about because Zemoria is one of my good friends and actually someone I really admire and look up to, and I'm just very excited about the conversation. So, a little bit about Zemoria is Zemoria Brandon is a social worker, administrator for Sickle Cell Disease Association of America, Philadelphia, and Delaware Valley Chapter. She brings years of experience working as a social worker in the sickle cell community and is a strong leader for SCD education, awareness, and advocacy. So, let me see if I can go ahead and find Zemoria, because you guys are going to absolutely adore her as well. Now, Zemoria, if you are here in the chat, just give us a wave or give us a thumbs up, and I will go ahead and add you. Oh, here we go. I hope everybody... Hi, Zemoria! How are you?
I am fine. I'm so excited to be in conversation with you because your journey, you spoke about me, but your journey has just been amazing and it continues to unfold. So I am looking to you. I admire you and what you've done, the statement that you're making, not only in the sickle cell community, but in the world of fashion. And I
Thank
love that.
you.
I
Oh my
love
gosh.
that.
When I got the sheets, like when we got that sheet and I was like, oh my God, I get to interview Zemoria. Like I was ecstatic. Like there's a lot that is going on in my life right now. I will talk to you a little bit about that off camera, but it's just a very, very crazy time.
Sure.
And I really feel like my world is like just upside down at this moment. But seeing that and that I was going to be able to interview you today just gave me confirmation that, you know, God has certain people in certain places that I need to hear from, and, you know, that is still in my corner, that's still here to uplift me and help me, and you are one of those people, so I just thank you for that. Like, I'm so excited about this. But now, did I get your intro right? Anything that you want to add to it? Yes.
I wear many hats. I wear many hats. Some you know about, some you don't know about. But certainly, as you've talked about me being a social worker, but I'm also an
really?
ordained
I didn't
interfaith
know
minister.
That. Okay.
Yes. Yeah, I'm an ordained interfaith minister since 2011. So I'm involved with communities of all faiths. And that's what being an interfaith minister means as well. I'm a mother, I'm a grandmother, I'm a caregiver for a brother in Chicago in a nursing home. I'm a former hospice volunteer. You know, I'm a communications person, so I do all the media stuff for our organization. So I wear many, many hats. And I'm also, just in case you've never heard this information, I am an installed queen for a royal family in Accra, Ghana.
Yes, royalty.
And yes. So I have another name that they've given me called Na Dede Ota the First, and that means one Mother Earth, one who nurtures and takes care of others.
Yes, that is so perfect
so that
for
is
you.
so befitting.
Oh my gosh. Well, now I feel like I need to like bow or curtsy like every time I see you and I'm in your presence, because you just, like I said, you are just a godsend, and and to so many, and especially in our community and like just around the world. You know what I mean? So my hats and everything off to you. I'm excited. Do you want to get into the?
Yes. And one thing for you, I want you to know I'm a former
See, and every
professional
time
model.
I see you, and every time like we're together, I feel it. I feel like you've done some modeling in your past because the way you carry yourself, like the beauty, you know what I mean, the way you do your hair, your makeup, like
Mhm.
I kind of got that you were like a fierce, fashionable presence. I just never had the opportunity to ask you that, so I believe it. Like, yeah. And now that you say that,
Mhm.
I might have to
Yes.
get you to do some modeling for me in the next go around for Devo Stars.
Okay.
Yes.
I would love to. I
Oh
would
no,
love to. Thank you so much. And I know we're here to talk about a very
we are.
important subject today, but I'm glad we had an opportunity to connect so that the
Yes.
conversation flows
Wait,
very
they said,
easily.
can you hear me okay? They said I'm having some audio issues. You can hear
Yes.
me? Okay.
No, I can hear you.
All right, cool. So let's get into
Yes, I
this.
can.
So, can you tell us a little bit about yourself, which you just did? But I mean, if you want to go ahead and like, tell us again, that's cool. If not, we can skip that one. It's up to you.
Okay. I did want to add to the conversation that how I got involved with this work. And it's the fact that my husband, the late Reverend Walter E. Brandon, I
Yes.
was married to for 25 years, and he had sickle cell disease, and he was the co-founder of this organization. So I met him in Chicago, got married. We moved here to Philadelphia in 1974. And because of what he was doing at one of the hospitals, and then starting this organization, this is how I got involved with the sickle cell community, and certainly continuing the legacy after his passing in 1998 at the
Uh,
age of 59 from
God bless him and
complications
God rest
of the
his soul.
disease.
And God bless you for continuing to carry the torch and,
Mhm.
just continuing to walk on and just help the community. Because you were, like, I can't even explain to everybody how fierce of a force that you are. And, like, anybody that has, I think, been in your presence, I feel like would understand the weight that you carry as far as, like, just the fierce air that's around you and like the just every accomplishment that you have and just everything. Like I cannot give you enough like flowers and props and totally deserve everything. And I'm so happy that you're still laying the groundwork for the community and still trying to continue to spread sickle cell awareness for us because there is no other there are some others like you know what I mean, that are here as advocates for us, but I feel
Mhm.
like you are seriously like top 5 in the grand scheme of like the advocates, if that makes sense. I do. I do.
Yes, thank you. You don't know what others see in you, so I'm grateful to be able to hear what you're saying about me because I just do the work.
Right,
I'm not
right.
looking for
So, like
anything
I
in
said,
return.
I'm just giving you all your flowers right now. All right. So, how have you seen
Thank
the
you.
SCD community impacted by the pandemic and COVID-19?
Well, I think for all of us, whether we had sickle cell or not, it was just such a devastating time to learn about this pandemic and the impact that it had on individuals and families, but specifically about the sickle cell community and the information put out about being immune compromised and how you would be affected by having sickle cell disease.
Mm-hmm.
I think it was a lot of fear, a lot of anxiety, you know, even about, can I go to the doctor? If I have to go in the hospital, what happens, when I go there, and then you're hearing that if you go in the hospital, that your family can't
Mm-hmm.
come, to be there with you, just a lot of anxiety about things that we normally would take for granted in the sickle cell community became paramount in terms of the impact that it had on their emotional, mental, and spiritual and physical health as well. So there's a lot of anxiety around just everything that you would normally do every day. Being with your friends. Could you be with your friends? Could you go out, and party? Those kind of things. How is my health going to be impacted? Am I going to be around people that may have the virus and not know it, And if I get the virus, then what happens to me? So those are the things that, I feel that I've heard from individuals that are living with sickle cell disease and the children, with sickle cell disease, parents that may have lost their jobs because of the COVID, the impact of COVID, or maybe having to work from home because their children are home being homeschooled, and that their jobs were compromised because of that. There's so many things, there's so many issues that that are still affecting the sickle cell community. So
Yes,
those
and
are
you're
the things
absolutely
that I
right
would
about
say.
that. Like, I know for me myself, like I'm still, and my mom, we were just talking, like I'm still like, that person that pulls out sanitizer from every crevice, every pocket, and like, will squirt sanitizer. I
Mhm,
have masks in my car.
mhm.
I have like gloves even that I carry for like when I'm pumping gas. You know what I mean? It's just something that I feel like we're so
Mhm.
still unsure of, that we just have to be we have to protect ourselves as best as we can. And like a lot of people think I'm very overly cautious, but
Mhm.
I feel like this day and age, especially since there's this new variant, you know what I mean? Like we can't be too cautious because we don't want to be careless and wind up, you know what I mean, like having not only sickle cell, but also now we have to deal with, COVID and trying to fight that off while having, you know what I mean? So I feel like any precaution that we can take
Yeah.
is necessary, and especially anything that you can do to protect yourself and
Mhm.
your family is absolutely important. So I'm so glad that you said all that. Now,
Mhm.
what do you feel
Oh
are the
yeah.
most common questions and concerns coming from the sickle cell community about COVID-19 and the vaccines?
Well, I think social media has played a major part in
Mm-hmm.
bringing forth questions, disinformation. Is that true? Should I believe that? And also their underlying health conditions, being immune compromised, is something that many people have been concerned about, their reactions to previous vaccines that they've gotten, is that going to send me into a crisis? Am I going to have to go in the hospital? What do I do if that should happen? And then the rapid response of
Mm-hmm.
creating the vaccine has a lot of people concerned, well, it seemed like they just did it in a few months. Is it
Mm-hmm.
safe? Should I take it? Should I talk to my doctor about it? Are my friends that have sickle cell, are they getting it? My family, are they getting it? A lot of this has
Yes.
created the vaccine hesitancy, you know, for especially for the sickle cell community, even though something came out from our national headquarters, our medical advisory committee, encouraging sickle cell individuals and families to get the vaccine, that it's safe, and trying to dispel some of the myths and misinformation that has been put out there, that really it's like a battle between two
Mm-hmm.
worlds or two schools of thought, about getting the vaccine. Should I or shouldn't I? If I don't get it, what happens? If I get it, what happens? And just all that you're seeing in the news, how the news media has had a profound impact on how people respond to COVID-19, the vaccine, the boosters, the Delta variant. There's another variant that's
Mm-hmm.
supposed to be coming out there. It just has people in a whirlwind. You're just in a whirlwind because you don't feel
Right.
like you have any
Right.
control.
And Yeah.
We've
And
lost
I'm so
control.
glad that you brought up the booster, because I know when this first happened and they were talking about, vaccines and all that stuff, like it was never a real hesitancy for me, because I talk to my doctors every month. And so, I always get my flu shot every year. And I was just like, all right, so there's so much unknown about this thing, but it seems like it's very deadly sweeping. This was like back in, February, March 2020. I was like, whenever I can get vaccinated, I'm getting it.
Hmm.
And my husband was on the same accord, and so was my family. Like,
Hmm.
they knew that they had to not only protect themselves, but protect me, and vice versa. So it was nothing like for me to be like, oh yeah, I'm just gonna get this, like no hesitancy. And now I just recently, what was it, 4 weeks ago, had my booster, and on the same day I got my flu shot, which
Hmm.
I don't recommend getting the I don't recommend getting them at the same time. But
Yeah.
I mean, I did it and I feel good. You know what I mean? I feel extra protected. So I'm just glad that you brought up the booster and all that stuff, because yeah, any little
Yeah,
protection
the
that we can
booster.
do for
Yeah.
ourselves is
Hmm.
needed. So thank you for that. Now,
Yes,
what kind
definitely.
of COVID-19 education and outreach have you done through SCDAA, Philadelphia, Delaware Valley Chapter, or other groups you're in, such as the faith community?
Well, I want to start with the
Yes.
organization Six Cells, which is a national advocacy organization, and very interesting. And we were quite honored to be one of the states, I believe 5 states, that was selected to be a part of this COVID-19 vaccine hesitancy program, and utilizing an app to be able to reach out to the clients that we serve in terms of not only if they got the vaccine,
Mm-hmm.
but what type of vaccine did they get? What complications did they have? Those kind of things. So we were a part of probably a 6-month initiative where we had a volunteer that was calling many of our clients to talk about this, but not making people feel like if they had not gotten the vaccine, that was a problem. We just wanted to provide them with the proper information so that they could make an informed decision, which many of them, after talking with them, there were many that said, okay, I think I'm going to consider getting the vaccine. So that was a wonderful
Mm-hmm.
opportunity to be trained and to be a part of a group that helped to put the information in the app in terms of the type of questions and information we needed to get from those clients that we serve. It was a wonderful, and it was actually done by a young man who has
Oh,
sickle
really?
cell, who's a pharmacist.
Okay.
And yeah, and so he was very excited to be able to reach out to clients to discuss, this type of information. So I say that Six Cells has been on the forefront of this COVID-19 vaccine
Mm-hmm.
hesitancy project. There are other groups that have come behind them, grants available through HRSA and all that. But I say Six Cells was the organization that became the game changer for the sickle cell community in terms of COVID-19 vaccine hesitancy. And just learning about the information has been very, very rewarding for all of the states, but I know for our organization, it has really helped us to have a better understanding when we speak with people that are living
Yes.
with
Yeah.
sickle
Shout out
cell
to Six
disease.
Cells. We absolutely love everything and everybody there. They're
Yes,
amazing.
right.
Like,
Hmm. Yes. And I also wanted to add that, we have also made it our business to participate in a lot of webinars, some coordinated by our national headquarters, Sickle Cell Disease Association of America, and other groups that, kind of got involved with helping people to understand the myths and the misinformation, what it is that we need to know, what your concerns are, because most of these webinars at the end, there will be Q&A. And there are many people that had concerns, not only sickle cell individuals, but people that work in the sickle cell community, social workers, psychologists, and all of that. So I think that we are well informed because of these initiatives in terms of helping people understand what's real, what's not. And in the faith community, because I'm an ordained interfaith minister, I've been involved in several sessions through the interfaith organizations in Philadelphia, including my church, which I'm a member of the First Unitarian Church of Philadelphia, to be able to understand what is happening, why it's happening. And of course, in my church, we have many medical professionals, including doctors, that we formed a team in our church where they can advise about what to do, when to do it, and all of that. So initially, of course, we started out with our virtual services, and now we're hybrid, where you can register to go in on a Sunday morning, but you can, because we've connected with people all over the globe through this virtual service, you can be at home or you can go into, your church. So it's been a great learning experience, an opportunity to be able to really understand. It's like you see the news and you know what's being said by Dr. Fauci and others, but learning on your own and really being able to own that information so that you can speak intelligently in a conversation like today about what the issues are, what's happening, why is it happening, why are people responding the way that they are. So it's been a game changer. The pandemic has been a true game changer, in terms of, and our lives, have completely changed. Families will be gathering for Thanksgiving, and the question is, with people, are we going to let everybody come? Are we going to let only those come that are vaccinated? Are we going to allow our family members that are unvaccinated to come? It's a challenging time, even though it's the holidays and we're supposed to be celebrating.
Oh, yeah.
But it is
I
a
get
challenging
all
time.
that, and it's just, this thing has rocked so many people and so many lives. And when you approach the holiday situation, you know what I mean? Yes, you want your family and all that stuff to be there, but then you have to have the conversation about, well, did you get the vaccine, or are you feeling okay? People get really touchy, so it's still we're in that gray area. But I feel with today's conversation, hearing from someone like
Right.
you, and just knowing that, especially in the Philadelphia area where you are, there's so many knowledgeable people that people can talk to and kind of get from their own research and opinions, and just get that extra stamp from. Thank you so much for all that you do. You're such a blessing. I can't even. I just wish I could come through and hug you. Yeah, it's virtual.
We can hug. We can hug. We can hug. The virtual hug. And I wanted to comment too about the mask. I think the mask is a very valuable thing to have in our toolkit. Wearing the mask,
right,
regardless of your status, to wear the mask. And I know we're tired of having our faces covered, and so what I do, I'm here, and if we're interacting, I have my mask on. But then I had to put my lipstick on to be on Instagram.
I feel you. Right.
So, because this is who I am, so the mask hides that, and certainly I wouldn't be on Instagram with my mask on, unless I was, in a room with a lot of people. But and now that the vaccine is being approved for children ages 5 to 11, so now parents have to make a decision about whether or not they want their 5-year-old, their 6-year-old to get vaccinated, and learning more about that. Is the needle the same size? Is it the same dosage? During the clinical trials, how were children being affected by getting it? So those are decisions that parents are faced with making right now. It's not mandatory. It's an option, but what will parents do? How will they feel
Right.
about getting their children vaccinated? So there's two groups of people, some that are excited and looking forward to it, and others are, still pulled back, just wanting to
Right.
see
And
what
it's the
happens
ones
over
that
time.
kind of have like the wait and see mentality that tend to like scare me. I understand it. I'm not judging anybody, but I just, I know everyone is free to make their own decisions and should make the best educated decision for their lives. But I just feel like in order for us to
Mhm.
get past this chapter of this time that we're going through, we all really need to be on one accord. So hopefully people will get there, you know. So,
Yeah.
but like I said, having voices
Mhm.
like you be a part of this fight, and all that is just going to, I think, send the trajectory of vaccine safety um, to the next level. So thank you so much for everything, everything. And
Yes. Thank you. What a blessing it is that
I
you
know, and
you
like
were the one to
listen,
interview
I
me
so
today.
needed this. Like, I need to. If you can call me, like, or if I can call you in like 20 minutes after we're done here, because I just need to talk to you, even off camera. So, can I give you a call in like
Okay.
20 minutes?
That's fine.
All right. Well,
That's
thank
fine.
you so much for being a part of
Yes.
this.
Okay.
Oh, and can you do me a favor? The pharmacist that you spoke of, can you give him Emma's contact information? Because we would love to even hear from him. If he could do one of these with us, that would be amazing. I feel like.
Oh, yeah, yeah. And he's actually doing some stuff. He's doing like I don't know if you call it a podcast. Every week he's doing
Oh,
something on a different topic, right now as we speak. And I'll get the information. You should know him. He's a great
okay.
guy. He's a really great guy. And Emma and Brina and
Okay.
Ashley, they
All right.
all
Well,
know
maybe
him.
he's actually signed
They
up,
know
and I
him well.
just hopefully we'll get to
Yeah,
interview him too. That would be great. Well,
that would
that's
be
all the
great.
questions that we have for you today. Is there anything that you want to, anything else that you want to add before we go? Your personal Instagram or Facebook or social media handles, any events that are coming up, any just like this is your time to just tell us everything.
Well, what I want to say is we have a wonderful event coming up on December the 9th. It
Okay.
is a sickle cell blood drive. And in the state of Pennsylvania now, the American Red Cross, when you go and donate your blood, you can also request to be
Oh
screened
wow.
for
I
sickle
didn't know they
cell
were doing that.
trait. Yes, you can be screened for a sickle cell trait, and you can also find out what your particular blood type is, because many of us may not know. We know that O
Mm-hmm.
is the universal blood type. So those that get tested that know that, they know that every 56 days they could donate their blood. And especially for those with sickle cell, we know how important
Yeah.
donating blood is, for those living with sickle cell and our children that have had strokes that have to be transfused every 6 to 8 weeks. So
Yes. I was that
you as
child
well,
from
right?
the age of
Yeah.
9 till 19. I was on uh, chronic blood transfusions for every 3 weeks. So I understand the importance of that.
Yeah. Yeah. So that's coming up, and we have a partnership with the Red Cross and Emmaus Health Sciences, and also Domain Real Estate Company. All three entities are working together to achieve the goal of 40 pint blood drive on December the 9th. So just so if you're in Pennsylvania, know that if you're at a blood drive, you donate blood, you can be screened for sickle cell trait. how many of us know whether we are trait carriers, since there's 1 out of every 12 African Americans that are trait carriers. And in terms of my social media
Okay.
information, I don't have any.
That's okay.
But if people want to, I don't have any, but if people want to reach me directly, I'm happy to give, the organization is the Sickle Cell Disease Association of America. We're the Philadelphia, Delaware Valley Chapter, and we provide services across the lifespan to meet the needs of children, adolescents, adults, and families living with sickle cell disease. So I'm happy to give my email address. I have no problem with that. And the phone number to our organization. The phone number is area code 215-471-8686. And my email address is Z as in zebra, Brandon, Brandon @verizon.net. I'm open to
Perfect.
anyone making contact with me.
Perfect. Thank you so much,
And I thank you.
Zemoria. This has been such a blessing. And like I said, I'm just so full right now. Like, I needed this. So thank you so much for blessing me, and blessing the people out here with your message and your
Okay.
beauty and your grace and just your awesome presence. So just thank you. I will definitely call you in
Thank
about
you.
20 minutes. And yeah, I will definitely make sure.
Okay.
Huh?
And happy
Hugs
holidays.
to you
And
as
happy
well.
holiday. Happy
Thank
holidays to everyone. Yeah. Happy Thanksgiving to all that will be viewing Instagram. We hope that everyone, all the family members will be able to gather that want to.
you.
It's such an important time. We've been through so much. It's an
Yeah,
opportunity just to give
yes.
thanks, just to give thanks, that we're still here, we're still standing. So I just say happy Thanksgiving and holidays to everyone that has
Yes.
joined us for this
Yes.
session.
Yeah. All
Appreciate you.
right.
Thank you
And I'll
so
talk to you
much.
soon.
Okay, then.
No problem.
All
Thank
right,
you.
then. Thanks
See
so
ya.
much, Tristan. Bye-bye.
Hugs.
Bye-bye. Hugs.
Bye.
Okay, bye-bye.
Oh my gosh. Such a great conversation today, you guys. Like I said, Zemoria blessed us. I hope you got her fabulous information, and I hope that you can connect with her if you need to. If you are in the Philadelphia or Pennsylvania area, please go to one of the blood drives that she spoke of. As she was saying, we are looking for 40 pints, which I am standing in agreement with. I believe that we will probably get over that and, wind up maybe with 50 or 60, God willing. So just do your part, stay safe, get the vaccine, just continue to educate yourself. Happy holidays, and continue to live well and stay healthy. God bless.